So your physician will tell you that tranexamic acid or mefenamic acid will reduce the blood flow. But let me tell you in simple um, language what is really happening. Ce qui se passe vraiment. What's really happening is that, so the blood, usually maybe you've complained to the doctor that, oh, excessive blood flow, high volume, more days than normal. So what they tell you is that, oh, take this tranexamic acid. By the way, it has a lot of side effects that you will not want. So my advice is to please discontinue. That's just my advice. I'm not a physician. I'll keep saying that, but for your own good, discontinue. So what is really happening is the blood is supposed to be flowing, 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 flowing. So let's assume now that the flow is supposed to be like 500 ml. Just an example, 500 ml. And now you've taken the drugs and you realize, it's an almost dry day. You're only getting like little trickles. You're like, this drug is working, but just imagine that there's like a funnel that it gets to, and then when the blood gets there, it just starts to clot, form groups, clot, 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 clot. Eventually it will just drop like one giant spoon of marmalade, of jam, of mayonnaise. It will just drop, poof. So you succeeded in forming giant clots. Some people's clots are this big. It's like birthing. It just drops.